The emergency room at Port Hardy's Hospital is closed for the second time in just a few weeks, and the Vancouver Island Health Authority says it's likely not the last time. The community has a shortage of doctors, so when there is no one available to staff the ER, it shuts down, and patients are sent to Port McNeill. That's nearly a half hour away. As A News reporter Gord Kerber shows us, people in Port Hardy fear it's only a matter of time before that half-hour trip becomes a matter of life or death.
A rainbow appears in the sky above Port McNeill's hospital. And just like a pot of gold, an emergency room awaits at the end. Small compensation for anyone from Port Hardy who's had to travel the extra half hour to get here.
For the ones that don't have the money to travel back and forth to McNeill, we have to wait till the hospital's open again.
Port Hardy's emergency room closed at 8 this morning and will remain shut until 8 a.m. tomorrow. The Vancouver Island Health Authority says this is the 20th time the ER has had to close for more than 12 hours since January of last year. Many in Port Hardy are growing impatient.
Well, that's crap, because they're closing it all the time. This isn't the first time. I don't know why it should be closed. There's enough staff up there to look after it. What are they talking about?
The MLA for the North Island says the ongoing closures are unacceptable. Claire Trevena says healthcare is compromised whenever the ER is closed, and we should be able to expect better. Administrators say their hands are tied. The regular ER doctor was going on vacation, and VHA couldn't find a replacement.
One of the physicians is currently out of town, and with the health authority and his own efforts, tried desperately to find a locum for this period of time. In fact, he delayed his vacation in the hopes of still trying to find a locum, and we just weren't able to do it for this period.
Port Hardy's Hospital is currently working with 5 physicians, one less than it would normally have. VHA says physician shortages are not unique to the North Island, but are being felt throughout the province's rural areas.
We have a physician recruitment department within VHA, and they've been actively working on this for some time. And I know the mayor in Port Hardy is also very keen to work on things from the municipal end to see what they can do.
Port Hardy's mayor agrees they could use another pair of capable hands up here, but Bev Parnham says the situation is much better than it used to be.
We've had some really big improvements over the last few years. We have a number more physicians than we did. VHA has been working really hard with the Mount Waddington Community Health Council to make sure that we do have our full contingent of physicians.
But even if an extra doctor is eventually located, there will still be some work required to restore confidence within the community of Port Hardy.
There's no confidence in the hospital at all. I wouldn't put any confidence in this. No, especially when they're telling you to go to Port McNeill for an emergency. Like, you can't even have a baby in this town.
VHA says things should return back to normal by the end of the week. In Port Hardy, Gord Kerber, A News.